Dr. Paul Feuerstein on the Dental Insiders. Again, thanks for joining us, Paul. We appreciate it.
And as promised, Paul was going to sing us his hit single from 1969.
Sing it.
Home Away from
Home
Home.
Away from Home, exactly.
Here's your new intro.
That sounds great.
I think that's going to be it. And that concludes,
At the end of that, that's nice. I like that.
So Paul, we'll jump right into it here. As we ended part one, we had started a nice conversation about technology. And so obviously, I think people who listen to this and watch this know that you're a technology guy. So I'm curious, there's really two questions in this. What one piece of technology has had the biggest impact on your practice? And then if you could recommend to a dentist out there the piece of technology they need to go out and buy today, what would that be?
Boy. Oh, since I've been practicing for such a long time, the most amazing thing that has changed dental practice and the world, you have to think about this for a second, is the internet. The internet was the most dramatic change of everything. Up until the internet became what it is now, we did things totally differently. You went to the library to get information. You had to go to courses in meetings and lectures. Your resources were all hand done. You actually read the dental magazines. The internet has changed the way we get information in and the way the information comes to us. So I think just on a global basis, I think that's probably the biggest thing that's changed everything. Certainly in a medical practice or a dental practice. People come to me a lot of times, and they say, okay, we want to become a high-tech practice, and I think that's what you're asking me. What do I need to get? I'd have to say the simplest entree is, number one, you have to have some sort of a network of computers in the practice itself. There has to be some sort of a way to have a visual. Now, I used to say to people, you have to have computers in every treatment room. I'm changing that a little bit as a mandatory thing, only because we have mobile stuff. We have tablets and things like that. But you still have to have some visual thing in order for everything else to happen, whether you're doing images, x-rays, scanning, whatever it is. You need some type of thing. So I would say, to me, I'll go back to way back. There was a great dentist named Dr. Robert Barkley. Dr. Barkley was I would say he's the first practice management expert. And his philosophy, and this is way back before electronics, was when your patient comes in, give them sort of a tour of their mouth, tell them what you see, explain what's wrong, and walk out of the room. Let them think about it, and then come back and say, so what do you think? And let the patient describe to you what they need. It's obviously a lot more complicated. So if I take that philosophy, to me, the key thing to me is an intraoral camera. Very simple thing. The intraoral camera, and these go back when they first came out, they were like, I think it was the AccuCam or something. These things were like $20,000, a gigantic cart and all sorts of things. And now they're down to little tiny things. Show and tell is the best thing you could possibly do. When a patient comes into my office on an emergency, certainly, they have pain or they broke that tooth, they have a big sharp thing, whatever it is. So simple. Take this image, throw it up on the screen, leave it there, don't say a word, let the patient look at it for a few seconds, and they'll say, see, did I crack that? Is that tooth broken? Is this what they'll start seeing things. So to me, that's the most important tool. The nice thing that's happened today is that the resolution has gotten very, very good on these cameras. It's gone to HD. The lighting with LEDs has gone spectacularly. So from me as a diagnostician, I'll sometimes see something, even though I'm using loops and magnification, but if I go up to the tooth with this high intensity light and the high def camera, I might see a fracture somewhere that I would have missed, or an accessory canal in an endo tooth, or just some odd aberration. And again, I'm seeing it, but we have the monitor so the patient can see what's going on at the same time. So I'd say probably, in my eyes, that's the key piece of equipment. Then you can pick one up for very little money. Truthfully, they're very, very, the more you spend, the more features there are. You can go into zooms and better lighting and better quality. If you just want to have a show and tell, there's a couple of cameras around. I saw a camera at Chicago Dental Meeting for $250. It was just a little simple camera. It was called, I can't think of the name of it for a second. They'll kill me. It was a simple camera, and it was just a basic, like the Brownie Instamatic of the intraoral cameras, but it showed a tooth. It wasn't the best resolution, but if there's a giant hole the patient could see, or a big silver filling, they could see something like that. And the only other thing I'd say, it's the next critical point, if you're spending your budget, would must have digital radiography. Those are the two primary pieces of the technology basis. So you have your infrastructure, and again, from a diagnosis, there's so much more you can see on a screen that's this big than a piece of film that's this big. And again, from the diagnostic standpoint, I think those are the two things. And patients can actually understand all of a sudden what's on an X-ray because they can see some of the. There's a black thing. It's called an area. Oh yeah, it's at the end of my root of my tooth, or whatever it is. So I think those. I think that's kind of a quick answer for that one.
Yeah, well, it's. I think your answer on intraoral cameras is it helps. I don't think all clinicians are great communicators. Well, not a lot of people aren't great.
The ones who aren't on this show.
We only have great communicators. Right. Well, and half of us are good communicators.
Half of us are.
The top half. So it's almost like the technology, whether it's digital radiography or whether it's an intraoral camera or whatever it is, it allows, or the tablet, the technology, if it helps be a better communicator, then it's kind of almost doing double work, right? It's the show and tell part, but then I don't have to talk as much. I'm not as comfortable talking because I'm not a sales guy. I know a lot of clinicians are like, well, I don't really like to sell, so I don't want to talk about it. But this kind of does it for them. And it seems like an easy way to bridge the gap.
No, and then if you take that a step further, if you really don't want to talk, there are products that have been around. The oldest one is probably Casey, and there's Guru, and a number of patient education programs. There's an app, I think it's called DDSGP on the iPhone and the tablet for like $400 or something, and it allows you to say, "Oh, you need a crown. Push the button. It's a professionally done thing. This is a crown. This is what we do. A to Z. That you need an implant. You need this. You need that." So you could actually just be a mute, have your camera and your patient education program,
right.
and just here's what you need. And patients kind of get that because it's electronic, so it's your instant second opinion. You say, here's what you need, and the picture says, oh, that's the same as my tooth, and boom, 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 boom. So yeah, that's a possibility, that communication. I hope it doesn't come to that.
Yeah.
So you referenced this earlier, and as we're recording this, we're fresh off another Chicago Midwinter dental meeting because February is the time to go to Chicago. And as you mentioned in the first part of the episode, let Paul do the walking. So you went to the big booths, you went to the small booths, you went to the micro booths. What'd you see that caught your eye?
Let me give you some categories first of all.
Sure.
Broad categories. There was at the same time the dental show was going on for the dentist, there was a laboratory show going on. And I actually, to be honest with you, I think the laboratory show was much more interesting in terms of what's coming in the future. This is all about materials. Everything from new types of zirconia and lithium disilicates and things like that to printing, 3D printing, which we're not ready to do yet for crowns, but we're on our way. And so that was the biggest thing. And there was a crossover from the lab show right to the main show. One thing that really caught my eye at the lab show was they were showing this in one of the medical companies. I think it was 3D Systems, as a matter of fact, had a product that they could make a flexible rigid metal. I said, a what? A flexible rigid metal, because it can be printed. It's printed with a lattice of some sort. So they were using it for people who have to have like a rod in their spinal column. They 3D image it using like a CT scan or like a cone beam around the spinal column, and they could print this little basket that wraps around the spinal column and is rigid but has a little bit of flex to it. And stuff like that. Wow. You couldn't even imagine. So anyway, so that was I think so. The material side of things was very, very interesting. There were a lot of companies with new materials, which we can talk about intraoral scanning and that whole genre. So that was the next big thing. There were a lot of intraoral scanners. You had your staples, you had Sirona, Itero, 3M, Plan Mecca, which was E4D, and they've all advanced quite. Each product has gone further and further and further and further. Itero probably made the biggest light speed jump. They went to a brand new, totally different machine, much faster than the original. That was kind of interesting. But there's other players too. Carestream is out there. So Carestream has something. It's called the 3500. At this show, they launched the 3600. So much faster, a little bit more high definition. 3Shape was very, very visible at both shows. Very, very cool thing. The Trios, excellent thing. A company called Dental Wings was out there with a new scanner. Dental Wings also had a laser mill. So if any of you are familiar with the Cirac mill or the Planmeca mill or the other mills, this is a laser mill, and it cuts completely differently. Real thin piece. You can cut a couple of veneers with this thing. Lots. Those are the cool things on the large end. There was some new lasers. BioLaser's been around with hard tissue lasers, and they keep improving that. Convergent was out with the Solea, a really very cool laser. You can get that spot down to like probably a millimeter and really cut very, very well with the hard tissue laser. And a couple of other companies, Photona was out there with a hard tissue laser. Alan Miller with AMD comes in with the budget hard tissue laser. So those were very, again, you just asked me what was interesting that caught my eye. As a GP, I saw a couple of interesting products developing, so restorative wise. And that one of them was a Voco Corporation came out with a new quote composite that's not a composite. It's a ceramic. So it's called, I want to say it's called Admira Fusion, if I recall. Totally different. It has no monomers in it. It has none of these bis GMA things in it, and people starting to get nervous about that sort of thing. Very, very different kind of a material. Totally different. Pulp Dent had a new material that's called Bioactive, and it actually rebuilds enamel, hydroxyapatite, with it as things are etched. So it's a crossover of restorative and chemistry. Doxa has Ceramere that does something similar to that in the cement. The other thing that, again, as a GP that caught my eye, it was Kerr has a cement that's called Maxem, and they now put color into it.
Yeah,
so it changes color, so you know exactly when to clean it up.
Yeah, they did I think it's a Chroma Color challenge or something like that. And helps. Yeah.
Yeah, so I saw something like that. So this is the kind of the odd things that I saw. The push, the cone beams were sitting out there too. There were cone beams all across the board. Some of them were very confusing, because when you're taking a cone beam, you can take a full head or a small piece or a small piece. Some of them had one machine that would take all 4 or 5 different sizes. Other ones, you had to buy a different machine for each size. Very confusing, but the smaller field machine was less expensive as an entry-level thing. So it's becoming more commonplace. And then I think I have to hand it to Sirona, to be honest with you, because they take a step back from all this. They're not interested in who has the fastest scanner, who has the best resolution. They look at a workflow. And they're very, very visible about how they do that. So they're taking this whole workflow from A to Z of the patient and not so much each individual component. So that's an interesting approach, and Planmeca is now doing that with PlanFit. And I think we should sort of step back a little bit and say, this is the fastest thing, this is the coolest thing, and say, well, how's it going to work in my practice? And I think those two companies have really taken charge of that. So I saw a little bit more of that. Henry Schein had something called Connect Dental, similarly, where they're taking this, they're walking you through the whole patient process. Have a cone beam, have a scan, have a this, have a that, and not necessarily selling a piece of equipment. So it's more of a concept. And I think that's been that was kind of visible to me. On the small side, I really, be honest, I didn't have a lot of time. I was teaching at the meeting, so I didn't have a lot of time to see the smaller stuff that I wanted to see. Those are my overall. Maybe the only other thing I think was a resurgence of phosphoplates in digital radiography. All of a sudden, they're coming back. They just reappeared.
Right.
Everybody said, they're no good. They don't work.
Why do you think that is, Paul?
Well, first of all, they come in every size. So there's a 0, 1, 2, larger size. So it's a little more. Some of the people are still having a problem getting used to using sensors. I don't really. We have used sensors for as long as they've been around. I don't really see the issue personally, but it's an interesting lower cost entree. And so in a giant practice, you could have 1 or 2 sensors, for example, and then these little plates, which cost virtually nothing. I mean, they're about $20 or $30, and it's slightly bendable and easy to use. And the new scanners are very fast. They're well under 10 seconds. So you have Air Techniques that had the ScanX Swift. Acteon had PSPIX. Carestream came out with one also, and a couple of other ones. So it gives another alternative. The interesting thing is that when you look at a sensor, the sensor has a plastic thing around it and some wiring around it. So the image is actually smaller than the size of the sensor, whereas with the phosphoplates, the whole image is the whole thing. So people are starting to say, gee, all of a sudden I have to take 3 bite wings with my digital sensor to get everything I want. So I don't know, but it was just interesting to see these things, and they were budget conscious too, and we're talking under $10,000 for these systems. So that was another interesting sidebar.
Well, and that's that's an interesting thing because I think phosphor plate's probably a good example of it. And some of the other examples you gave, it's easy for us all as consumers to want to get the biggest, the fastest, the newest, the brightest, the whatever, because it's easy to see right off the bat. Workflow is a much harder thing to grasp because we all practice differently.
Right.
I just said we.
You practice much differently.
I practice far differently from anyone else. So it's the workflow is a harder argument, but it's to me the right one. And it seems like it's taken so long to get there that in the long run, it's a better way to sell a system or to promote a better overall philosophy on how to treat patients.
Well, and
give me a new product. Talk to my. Give me a new product that's going to help me in my practice. Not that it's cool, it's slick, it has better flashing lights. I mean, I think that's the mantra here.
And if you're talking about selling a product, and this kind of goes back to something Paul said earlier about patient care, and other guests have mentioned this as well. If you're just trying to sell a product, you're not necessarily making a connection to better patient care. But if you are able to communicate a positive change of workflow, then that is more easily grasped, the effect on the patient care.
And if I could just add one quick thing. I see a lot of products coming out that were designed because someone thought we needed that, and they never asked us if we needed it in the first place.
Yeah.
And I won't give a specific example, but there was some things I thought, who would even use this thing? So some dentist in Arkansas does dentistry a certain way, but the rest of us don't do it that way. But he or she found that this was a necessary piece of equipment to do this thing, and they come out and market without really doing their homework. And that's something that really bothers me sometimes.
Well, and it's just a reminder that we are all individuals, and what works one place doesn't. What plays in Peoria doesn't always play in Philadelphia. Yes, that's what I was going to say.
I wasn't sure where you were going.
What's the difference? I have a question. A couple minutes ago, you said you were talking about 3D printing, like a crown eventually being 3D printed. This is really a stupid question. I'm asking a dumb question.
There are no dumb questions.
Just dumb question number one. What would be the difference between a 3D printed crown and the way Sarah currently does it with a mill?
Oh, simple answer right now. Porosity. It's more porous at this point. They can't. Using Cyric as the example, those blocks are fired in an oven before you do it. Or if a laboratory is doing it, it's a giant puck. It's called a puck.
So it's harder.
It's fired. Those zirconia pucks you are really robust. So printing it at this second doesn't give you that robustness, that full tightness, I guess, of the way it's integrated. It's just not as robust at this point. You can do temporaries, things like that. You can do anything in acrylic, pretty much. They're trying to print now aligners, the type of aligners like Invisalign has, things like that. Things like that can be done, but nothing that strong.
Okay. Then maybe that wasn't as stupid of a question.
No, there are no stupid questions. Only
because I see that mill going. It looks like it's going 3D.
And then there's also the base level subtractive manufacturing, milling, you're taking away from versus additive manufacturing. And I guess there's questions, can you be more accurate with additive than you can with subtractive, which is probably an open debate.
But you can print gold, you can print bars. I mean, there's things you can still print. But for whatever reason, the FDA is also sitting on top of this too. They're not ready to release any of these materials. So we'll see it. I mean, we're going to see it. It's just a question of waiting for the technology to catch up on that one.
Yeah.
So we're about out of time here, but I think one last question, very, very broad. What's the future of dentistry?
I would say using all these cool things that we talked about and doing a digital diagnosis for your patient when they first come in the door. We have the ability now to see things in 3D. We can look inside of teeth. We can look inside the jaws. The technology will let us have some algorithms that will actually read X-rays, read these things, and give us information, kind of dumbing it down in a way. Two quick examples is for years Kodak, now Carestream, had something called Logicon, which actually reads bite wings. It reads the interproximal bite wings. So there's no reason that can't be blown out to a larger percentage. A company called Lexicomp. They're known for their medical books and things. They have a program. If you have a lesion, it just asks you a question: what size is it? What color is it? How big is it? Where is it? And it goes down. All of a sudden, says you have pemphigus or whatever it is. So things like that. I think artificial intelligence will come into this. I think that's where we're going to go. So the diagnosis will be more precise for us, certainly for the patient, and that big fancy word, minimally invasive dentistry. We keep more of the patient than what we put into it. That's the biggest thing to go on. So I think that's the key. Just forget Mr. GV, Dr. GV Black, go away. And let's go back. Let's only do what we have to do, even to the point where we may be able to remineralize teeth and add new enamel, new hydroxyapatite, which I mentioned. There's a few materials that do that too. So I think that's the crystal ball. Literally awesome. Crystals.
That's great. Well, we'd like to thank our guest, Dr. Paul Flintstone, for joining us on this episode of the Dental Insiders. Be sure to tell your friends and colleagues about the Dental Insiders. Thanks again, Paul. We appreciate your time.
Paul. It's been my pleasure, guys.